Did you know that healthcare entities depend on their patient outcomes, and that home health does as well? Home health providers need to ensure the care they provide creates the best outcomes for their patient populations. It is important to note that outcomes measurements may vary from setting to setting. One measurement that transcends the post-acute environment is the rehospitalization percentage, which is the percentage of patients on the agency's caseload that are readmitted to the hospital. A transdisciplinary approach is crucial to create the necessary communication and collaboration needed to avoid a patient's potential rehospitalization. Preventing a patient's rehospitalization is important to not only the home health agency providing care, but to the patient as well. Therapy can play an active role in preventing rehospitalization. Now let's discuss condition management. When the care team knows the patient's primary diagnosis or comorbidity diagnoses that have a trend toward higher incidences of hospitalizations, they can take steps to monitor the patient's status more closely. They should be aware of warning signs and monitoring of disease progression or exacerbation. When the team recognizes the patient presents with a progressive or cyclical disease process, it is incumbent on the team to closely monitor the patient for any signs or symptoms of that process beginning. One way to do this is to analyze vital signs. Therapists can take vital signs before, during, and after physical activity. They can determine the impact of their interventions on the patient's physiological response, and they can analyze when those vital signs are counterintuitive to performing any strenuous physical activity. Other things therapists should closely monitor is the patient's drug regimen and the patient's medication management. The rehabilitation team should be another set of eyes for analysis of the patient's drug regimen and its effect on the patient's performance and well-being. Also note that a skilled clinical team cannot be present in the home at all times. Transitioning knowledge and care to a caregiver, family member, or to the patient themselves ensures improved carryover of important care delivery or monitoring even when the care team is not in the home. One question that should be addressed is, can the patient maintain the gains achieved while in therapy when that therapist is not present for cueing or adjustments? By artfully staggering therapy services and transitioning therapeutic practice to the patient or caregiver, the therapist is testing the patient's durability of response. Durability of response speaks to the patient's sustaining that performance over time. This is an important component of the treatment plan. In short, this means how much of what is learned or gained in mobility or self-care will remain when the skilled service has been completed or titrated down. A therapist must slowly remove their skill from the situation and then observe whether those tasks, activities, strategies, and the like maintain their presence in the absence of therapy. This can result in decreased need for additional services by extending the patient's stay of wellness, allowing the patient to continue to age safely in their home and prevent rehospitalizations. By removing therapy visits from the reimbursement structure, PDGM allows for agencies to use different methods to monitor and support patients under their care and prevent rehospitalizations. One way is through the use of virtual visits or other patient contact. An interaction with the patient or family through a quick phone call or through a HIPAA-compliant video chat technology allows the agency care team another way to keep that clinical connection to the patient and help monitor for changes or worrisome trends. With so much information regarding the details of PDGM, Aegis Therapies will continue to stay on top of changes and new information to help you feel secure in this developing reimbursement environment. Please visit our resource center to stay up to date.